Today is a beautiful day. I welcome you to the first episode of The Healing Stories. My name is Dr. Alex, and in this first episode, we are going to talk about UTI and marriages. But before we go into the UTI and marriages, it's important that we first begin by understanding what is a UTI. A UTI is just a short form of urinary tract infection. And what is this urinary tract infection? A urinary tract infection, as you hear the word, is an infection that occurs in any of the parts of the urinary system. And what are these parts of the urinary system? Let's start from up. We have the kidneys, the two kidneys, we have the ureter, come to the urinary bladder, and then down to the urethra. So any infection that occurs in any of these organs is what we call a urinary tract infection. Now, when you look at this urinary tract infection, the most common cause of this urinary tract infection is a bacteria. And this bacteria, allow me to say it, we call it Escherichia coli. You will find most of the people abbreviating as E. coli. Of course, the word Escherichia is quite botanical, for lack of a better word. And when you see these urinary tract infections, of course, these are the diseases that affect us. But over the years, and due to research, and due to certain factors that I'm going to tell you in the subsequent few seconds, is that we have seen that these UTIs are very common. They're very common in women more than in the men. And why do you think this is this way? Why do you think the trend is this way? Now, one of the issues, or one of the significant issues, is the anatomy of the female genitalia, or the female reproductive system, or basically how God created a woman. I'll begin by the most scientific part of the system. That tube that connects the bladder to the outside environment is called the urethra. When you look at that tube, the distance from the urinary bladder, which is the storage unit of the urine, to the outside environment where it passes out, in a woman, that tube is only 4 centimeters. And do you know what the length is in a man? The length of the same tube in a man ranges between 18 to 22 centimeters. Now you can imagine, the shorter the length, the easier or the shorter the distance that bacteria traverses to come and attack and, of course, create its outcome of bringing the sickness that we call the urinary tract infection. Now, when you divulge ourselves deeper, when you look at also the female anatomy, and remember I told you earlier that that bacteria called the Escherichia coli, or the E. coli, as the common cause of this urinary tract infection, is actually a bacteria that is a normal flora within our gastrointestinal tract. The gastrointestinal tract in P2 is what they used to call the alimentary canal, that tube that runs from the mouth to the anus. Okay? But when you look at the anatomy of the woman, when you look at the urethra, the proximity of the urethra and the anal area, that distance is quite short. That's why the saying goes in the village, your mother, and growing up, the senior woman at school used to tell you, when you are cleaning yourself as a woman or as a girl, do not clean coming forward. Why? It's because due to the proximity, you will transfer the E. coli from the backside to the front part. Then you'll be the one saying, I'm struggling with these UTIs. I am using my own toilet at home. I'm using my own latrine at home. UTIs. UTIs have become UTIs. I'm not sleeping with anyone. I'm sexually inactive. I'm sexually docile. But UTIs have become UTIs. No. You're infecting yourself because of lack of knowledge. And that's why Healing Stories comes in handy. So stay tuned, because we are coming to dive deep into these issues. What are the risk factors of these urinary tract infections? Remember, as I said earlier, the major cause is that bacteria called the E. coli. But of course, this E. coli takes advantage of a certain situation. Now, those are the situations I want us to discuss. 1, poor hygiene. What are the toilets how do the toilets that you're using look like? That's number 1. 2, Sexual activity. Hey, sexual activity, very important. How many people do you have sexual intercourse with? Different people, very important. Number 3. Now, this one, I would like us to go to those of us out there that have conditions like diabetes mellitus, have conditions like HIV, or any conditions that destabilizes our body's immune system. Because when the body's immune system is destabilized, then this E. coli that I talked about earlier, that bacteria, will take advantage. Water intake. The temperatures have been high. How much water do you take? Urine, retention in the bladder. Some of you enter that taxi, you go to town and you say, these toilets in the arcade are very dirty. I'm going to keep my urine until I go back home. No, that is very harmful. In fact, I'm going to discuss it earlier in the subsequent seconds, that keeping urine is a very terrible issue when you keep urine for so long. You have come from Chiwanga, you have come from Chiwatule, you have come from Chira, you are going to Kampala, in the taxi there's traffic jam, you have reached there, you are feeling you want to pass urine, but you are saying, you know what, these toilets are very dirty, I'm not going to use them, I have to go back to my self-contained apartment in Nigeria, and then release urine there. Okay, your self-contained apartment is there, but let me tell you, you are going to spend a lot of shillings treating that UTI, and yet we can prevent it. Okay? Then finally, the mothers of our nation. Pregnancy is a blessing. Hormonal changes occur during pregnancy. And of course, we call the pregnant vulnerable. Why? It's because when they're vulnerable, then anything slight can come and destabilize the status quo. Yes. Also, hormonal changes that occur when we talk about pregnancy. Yes, during pregnancy, or when a woman is pregnant, the chances of contracting urinary tract infections are quite high. That's why most of the times when you go to antenatal, doing a routine urinary test or urinalysis, it's done every time you go for antenatal. In fact, some obstetricians and gynecologists are even advising that it's important to just do it routinely every month for as long as that you're pregnant. How do we know the signs and symptoms? Now, I'm talking about this in general. The man listening to me, the woman watching me right now. Number 1, the most common sign and symptom across both sexes or across both genders is a burning sensation of urine. Most of them come to me and tell me, Musao, I feel the urine is burning me. Yes, that's one of the signs. The other sign would be cloudy urine, very smelly urine. Then we can talk about the lower abdominal pain. This is very common in the women. Then sometimes it may radiate to the back. Then even for the men, some of the signs are common in the same way. You may also feel low abdominal pain. One man came and told me that this woman was telling me she had low abdominal pain, and on checking she has a UTI. But for me, I have no uterus. Why do I feel low abdominal pain? No, hello, you may not have a uterus, but when you look at the anatomy of the urinary system, we have that bladder that moves up on your waistline. You man watching me, on your waistline is where the bladder sits, okay? So when the infection of the bladder reaches there, the bladder, it is a sac like this. So this sac, when it becomes infected, the walls of the sac become inflamed due to that infection, a condition that we call in medicine, we call it cystitis. So when it gets inflamed, the pressure exerted by tucking in that belt and then sitting in this posture that I'm seated in causes that pain. But most of the times, that comes when the UTI is been long-standing. But the most acute signs and symptoms that we always see, or that you may always feel, is that burning sensation when you're passing that urine. Now, the most important of what has brought us here, as I said in the beginning, in this episode, our main focus is these urinary tract infections and marriages. How have these UTIs affected our marriages? Dear man listening to me there, we may put all the blame to our women, but even you, when you have these UTIs and they're long-standing, your performance, your performance will be hindered. Hey, I'm coming, let me come. Now, I've been looking for this wonderful opportunity over the years. For the 7 to 8 years that I've been in clinical practice, I've been seeing patients, treating patients of different caliber. And the most common thing, a story that stands out and I vividly remember, is this amazing couple trying so much, working so hard to give the best shot of life to their children. The husband gets a job up country, the woman remains in town, and every single morning she boards the taxi, enters into that jam, and she goes to town. But once in a while, when the husband comes back, coincidentally, whenever he comes back, the wife is either undergoing a UTI treatment or 2 days. When he has come back, the wife begins experiencing those signs and symptoms I talked about earlier. Now this man comes to me and tells me, Naimusawo, I have a problem. I have a challenge. In fact, I'm even failing to perform well because even whenever I go to that game, my mind is in between. I said, why, my friend? He told me, you're a married man. I said, yes. My wife may be cheating on me. And he told me, I think my wife is cheating on me. I said, why do you think so? Every time I come back, she's either finishing treatment of the UTI, or whenever I'm here only 2 days, she's feeling burning pain, back pain, and all those kind of things. I said, okay. And looking at it, trust had gone. And marriage, the foundation of marriage is trust. And once that trust is broken, then everything comes down falling. So I was very kind enough to listen to him. Then I told him, you know what? We shall not handle these issues, the two of us. This is a conversation that we want. Stop finger pointing. Let's have this conversation as a family. I know both of you. Let's have this conversation. Then, of course, he called in the wife. We had a conversation, a one-on-one discussion. And I had to educate this gentleman and told him, you know what? Look at the working environment of your wife. Anatomically, the way God created women, they have higher chances of contracting these urinary tract infections. But most importantly, is when you go to those arcades, how many people use those toilets? So the problem is not actually with your wife. The problem is with the situation that we live in. Okay? And then the other thing also, and this goes back to you men out there. Whenever your wife is diagnosed with a urinary tract infection, the policy is clear. For as long as a couple, you are together, the two who have been married and have become one, you share problems. There's what we call the test and treat policy. Okay? Yes, we shall test the woman and then treat the woman. However, once the woman is diagnosed as having a urinary tract infection, then we do what we call partner treatment. Most of you say, for you are sick, let me go and check. When you check, of course, the urinalysis results come out and they're very normal. Yes, it is possible. That is possible, yes, it's very possible. Okay? But you have a reason why we do what we call the partner treatment. Okay? So, let us embrace this, dear ladies and gentlemen out there, dear wives and husbands out there. The issues of UTIs shouldn't be issues that break the marriage. We shall agree, yes, UTIs can be spread through sexual intercourse, but not only sexual intercourse causes these UTIs. Not only sexual intercourse is a risk factor for these UTIs. There are other factors. Okay? So let's correct these myths and misconceptions, because the foundation of life is the family. And once the mother and the father are not at par because of the myths and misconceptions that arise because of the ignorance, and that's why the Healing Stories comes to correct that ignorance. That's why I'm here, to correct that ignorance, because sometimes you tell people this, then they go and act in the opposite direction. So let's correct these misconceptions, because moving forward, let us be supportive. When your wife is diagnosed with the UTI, be responsible, be part of the journey. Treatment is a journey. When you're called by the doctor and they tell you, you know what, if your wife tells you and tells you what, I've been to the hospital and the doctors advise you also take treatment. Yes, be religious and be kind enough to take the treatment. Why? Is because you are doing or you are supporting your wife through this journey. Okay? And most importantly, once this is not corrected, it will affect your performance in the home. And once performance is affected in the home, then the home will capsize. Now, let's go ahead and talk about the diagnosis and treatment. Now, feeling those signs alone, and I'm going to remind you, not every backache is a UTI. It's one of the signs, but not every backache is a UTI. Not every low abdominal pain is a UTI. Okay? So, even when you feel these signs and symptoms, that's why it's important you come to the hospital, they take off that urine sample, they run that test, and then finally bring results that actually show that actually you're positive for this urinary tract infection. Get the diagnosis. Then after you're diagnosed, then treatment is given to you. Now coming to the treatment, I said earlier that these urinary tract infections are predominantly caused by a bacteria. So there are specific antibiotics or antibacterials that we give to kill this bacteria. But there's a very big problem, there's a very big vice, there's a very big cancer in this country. You people who get diagnoses from ChatGPT and internet, we went to school for a reason. Yes, we went to school for a reason. We are here to help you. Otherwise, we wouldn't go to school, we just treat you from ChatGPT. You feel abdominal pain, urine is burning you, then you are running to the nearest drug shop. Bampeyo Casipro, Bampeyo Caseptrin. Hey, hello. Now, some of you have been treating UTIs from January to December, you never recover. And you're using Cipro. Now, allow me to bring to your attention. There's what we call irrational drug use. And that's what you're doing. Self-medication is dangerous. It's like giving yourself rat poison. Because too much of the drugs that you're taking that are actually not important is poison. Okay? Yes, so you get the professional attention. That's why I'm here. Reach out to me. Hey, that's why I'm here. Okay? So there's a lot of resistance that has come. A patient comes to you, moving with a cannula has become a design. Everywhere, cannula. Hey, what are you getting? Safe, UTI. January, safe, UTI. February, safe, UTI. Hey, safe, UTI. Safe. By April, safe is no longer working. And this is happening. You may even be a victim. You may be listening to me and you're a victim. Yes, it is true. That's why, because we don't tell, that's why we always advise, do not treat yourselves. Okay? Because in treating yourselves, you create room for antibiotic resistance. Some drugs stop working on you. Okay? So we have to go ahead, incur extra costs to take over that urine sample, do a culture and sensitivity to see what drug is sensitive, what drug is intermediate, and what drug is resistant. And I'll tell you something. The common drugs that we use are cheaper. But most of the times, I have seen this. A patient comes to you, you do a culture and sensitivity, the patient does not respond to levofloxacin, the patient does not respond to cefixime, the patient does not respond to the nalidixic acids, to the nitrofurantoin. At the end of the day, you do a culture and sensitivity, and the patient is only responding to those drugs, imipenem, cilastatin, meropenem, and those drugs are damn expensive. Okay? So let us avoid those costs by following the right and correct channels. Very important. Okay? So let us be religious. Let us support our own selves. Very important. Have the symptoms, yes. Once you have seen them, go to the hospital, get checked, properly diagnosed, and given the right treatment. I think when I say this or when I speak like this, you should know, starting tomorrow or starting today when you have those signs, don't run into that drug shop before actually knowing the diagnosis. But the beauty is, all this can be prevented. We can prevent all these UTIs. How? One, let's improve our hygiene. The ladies, do not clean from back to front. Do not. I told you earlier, the proximity of those two orifices, or those two openings, once you bring the other one here, importantly, Ugandans don't like taking water. Let us hydrate ourselves. Let us take water as much as possible, because the more water you take, have you ever been there whereby your urine is yellow, okay, because the normal color of urine is that amber yellow, but then you take water to a level that when you go to urinate, the urine is actually watery. Now that is good. That's what we call bladder irrigation. That's what you should often be doing, okay? Then promiscuity, sexual activity, jumping from here to here, here to here, here to here, like as if you're a multi-tester. What are you testing? What are you testing? Okay? So let us be faithful to our partners and let us support one another. And then finally, there is a product called cranberry juice, and there's a misconception. A patient told me that actually cranberry cures UTI. No, it helps. It helps. Do you know why? Because when this bacteria moves from the urethra and comes towards the bladder, it sticks on the walls of the urinary bladder. So what cranberry does, it helps to detach it. And once it detaches it, through urinating, you flush the bacteria out. So cranberry is quite good because it just helps on the urinary tract health. Okay? That's why we tell you it's always good to frequently urinate. Do not keep urine, because whenever you keep this urine, it sticks, the bacteria sticks there, it multiplies, causes cystitis. Sometimes it even moves through the urethras through the ureters to the kidneys. Then you get what we call pyelonephritis, get kidney complications. So we don't want to go there. Let us prevent as much as we can. Finally, allow me to tell you, teamwork makes a dream work. The Healing Stories comes here as just a supportive party. We are coming here to support you. We are coming to give you education. We are coming to find ways of preventing diseases. We are coming to find ways of preventing that cost. What is your salary? How much are you earning? And how much are you spending on health alone on every single month? Seriously. The Healing Stories is here to support you. And for our dear marrieds, let us support one another. Not every time that your wife has a UTI, she's cheating on you. No, don't slap those women. And those women, don't beat up the men. These days, women go to the gym. They have very strong women. Don't beat the man, okay? Come to us. We shall give you this information. And then let us bring this back home. Thank you so much. Thank you so much for watching the Healing Stories. This has been UTI and Marriages, our first episode. Do not forget, click on that button. Subscribe, follow us on TikTok, The Healing Stories, follow us on X, and if you want to be hosted on the show, yes, this is for you. Just comment down there, and we shall give you a chance. Thank you.